Now I would like to invite Dr. Hannan to tell us about the map of the medicine and how it helps the doctors dealing with the cases of dementia. Dr. Hannan.
Right, just before I start, can I just ask, has anyone heard of the map of medicine? So approximately about a third of the room have seen it. Okay, well what I'm going to do is I'm going to introduce you hopefully to the map of medicine. The map of medicine is an evidence-based patient pathway tool that's been designed by the NHS for clinicians, for doctors and nurses. And it provides evidence-based care that you can access from the desktop to see how you'd manage certain conditions such as dementia. I should say I'm the map of medicine clinical lead for the North West Health Authority. I've got a little bit of understanding of this, and I'm going to share a little bit about it and why it matters. I'm going to talk a little bit about how we try and keep up to date with all the developments that are going on in medicine at the moment and how we can possibly keep on top of everything and continue to provide the best care possible. Describe what the map of medicine is, perhaps have a little bit of an insight into what it tells us about dementia, introduce something called NHS evidence. Has anyone heard of NHS evidence? No, so hopefully that's something new that I'll be introducing you to. And perhaps finally just finish off with some of the things that are going on inside Horton Thornley medical centres to give you some sort of vision about what we're trying to do to try and help improve care both on our side as clinicians but also for patients and carers hopefully. Okay, so let's start with keeping up to date with developments in healthcare. Believe it or not, there are over 5,000 papers coming out every single day which have some kind of bearing on what I do as a GP. 5,000 papers a day. So how the hell do we keep on top of all this stuff? Is beyond me. I decided to type in dementia into Google, because everyone Googles, don't we? And 11.5 million websites came out. So if a patient came to me and said, Dr. Hannan, I've got dementia, and I said, right, well, can we just park you there for a minute? I'll just go over 11.5 million websites, or go through the 5,000 papers that have come out today, looking at the ones that tell me a little bit of dementia, and then we'll come and talk to you about it. Of course, we've got to remember, it's not as if I've nothing else to do. I've got all the other things that I've got to do in terms of seeing patients, visits, letters, test results, perhaps coming and do talks like this. So that comes after all these other things that we're expected of us. And of course, there's something about the fact that in the past, medicine was kind of simple, wasn't it? Because you just went to the doctor and the doctor fixed you. And no one really, didn't really need anybody else. But now we seem to have lots of different organisations, lots of different places to go to, lots of different teams of people. There's a new flavour coming out. We're going to be hearing about a new flavour that's coming out later, hopefully. And trying to understand, well, who do I need to go to try and help me with my little bit of my little problem? So we've got multiple teams and multiple organisations that keep coming out. And this is really kind of scary, because the net consequence is that the evidence suggests that it takes 17 years before evidence that proves something works actually hits practice, where we actually see it happening on the ground. And for those of you that are wondering where that evidence has come from, that's when the proof for the treatment for Helicobacter pylori came out 17 years ago, and it took 17 years for it to actually become part and parcel of what NICE says. But I want to finish with two thoughts. And the first is that knowledge is the enemy of disease. We're now in the knowledge age, and if we have knowledge, and if we can spread that knowledge, then that's how we're going to get rid of disease. It's not going to be a magic tablet. It's not going to be some magical little bit of programming on a computer. It's knowledge in its entirety. And the other one that might surprise you is that actually the future's here. It's just not even the distributor. And these are both quotes from Samuel Gray, who's the Chief Knowledge Officer in the NHS. In other words, we've actually got the knowledge, we know what to do about it, we've just got to spread it. We've just got to get it out there and get it all out to as many people as possible, and you'll suddenly find that we actually can start to win the battle against diseases such as dementia and so on. Okay, so what is the map of medicine? Well, I mentioned it's web-based, it is evidence-based patient pathways. And what I mean by evidence-based is in the past, many eons ago, doctors used to stick their finger up in the air and say, I wonder which way the wind is blowing, or dare I say, which rep's coming through the door, and then suddenly start that treatment. And actually, we've turned around and moved away from that to start saying, well, what are we doing now? If we're going to do something differently, can we show that it's made a difference? Has it improved things? Or in the case of dementia, where you're actually finding a worsening of function going on, can we try and stabilise it so that that worsening doesn't continue? It's looking at not all conditions, but the common and important ones at the start. It's continually expanding and there's more and more conditions coming on. It can be localised because clearly the way we manage dementia or a certain condition here in Tameside may well be quite different to another part of the country or another part of the world or whatever. So we can look at what we're doing here locally, what we've agreed locally we want to do, and then start to share that knowledge through that. It can provide administrative data. So if there is someone here who's got this great new service that you just want everybody to know about and yet your phone never rings because no one knows about it, there's the opportunity for you to put that number into the map of medicine so that if someone wants to know how do I do this bit here, we can find that number and just ring it, or an email address or a website or whatever else it might be. So it can be localised. It is designed primarily for doctors and nurses, but most importantly, it can be accessed by patients and the public and carers. So although it's just being designed for doctors and nurses, patients and the public can see it as well. And most importantly, the NHS has bought it for all of us throughout England and Wales, so it's free access. You don't have to pay for it to get it. This is what it looks like. This is the screen. And I should say, this is the screen that the doctors and nurses get to see. I'll come to a moment to what patients see. There are 4 different ways of finding whichever pathway you want. There's the simple Google search where you just type in the term, and I've typed in dementia there, and hit the search button and things will come up. There's this pathway one which is kind of like the iTunes way of doing it. If anyone knows iTunes, and you can sort of click on this, then on that, then on that. So here it's mental health, other, dementia and dementia assessment, and you click on that and that will take you straight through to how to assess someone who might have dementia. You can do a search through pathways, or you can just slide it down here and find dementia, and there's an example of dementia there. So there are 4 different ways of doing it. You'll notice that there's a Tameside and Glossop view. For those clinicians in Tameside and Glossop, we've all got smart cards. And it's a little credit card with a little microchip on it. You plug it into the computer, that will then open up Map of Medicine if you've got it set up like that, and it automatically recognises that you're in Tameside and Glossop. So you're not having to find the Tameside and Glossop view, that's the one that comes up. You can immediately see how care has been organised locally within Tameside and Glossop. There are other views, because every area in the country, or at least in the northwest at least, has got a Map of Medicine view, and there's also the international view. Okay, so let's click on dementia, and what do we get? And what we get is 30 different results that you can go through. And this is on the Map of Medicine. There is something else called the National Library for Health, so if you wanted to look at evidences for things or other aspects, you can also see that there are 14 different things that you can look at up there. And you'll see at the first one, dementia vascular, and then dementia assessment. What I want to do is say, well, I've got this patient who's a little bit forgetful, I'm not quite sure what I need to do. I wonder what the Map of Medicine says, so let's click on that. And this is what comes up. It says suspected dementia, because of course patients don't come in to me saying, I've got dementia on my head. They come in saying, I'm forgetful, doc, or my husband's been beating me up and I don't quite know what's going on and I'm not quite sure. So let's have a look at that. And then I'll talk you through the pathway in a moment. You can see the key there, and green is primary care, in other words general practice or in the community, and blue is secondary care. That's what happens when a patient gets referred into the hospital, and I'll show you that in a moment. We've got something called the provenance. One of the great things about the Map of Medicine is we've moved away from the sticking the finger up in the air and wondering which way the wind blows, or it was the last rep that came to see me, to, well, why should we follow this pathway? You know, I've got my own thing, I know how I've been doing it, I know how the doctor that trained me 10 years ago is doing it. Well,